The National Retiree Legislative Network, better known as the NRLN, is pleased to offer information that may assist you in making your 2020 Medicare enrollment selections. The best information we may offer you is to urge you to read your 2020 Medicare and You Handbook. Then if you have questions, call your state health assistance program, SHIP, for personal counseling and/or call Medicare at 800-633-4227. SHIP counselors are trained to fully explain plan options but do not advise. You'll have to decide for yourself. The number you should call is located in the middle of the back cover of your Medicare and You Handbook. Whether you're turning age 65 and enrolling in Medicare for the first time, or wish to switch supplemental Medigap plans, switch Medicare Advantage plans, or switch from Medigap to Medicare Advantage or back, you most likely will come down to choosing between a supplemental Medigap G plan or a Medicare Advantage Health Maintenance Organization plan, HMO. We used these two plans as examples because they're the most popular. Medicare Advantage plans are viewed as the lower cost alternative of protection, while Medigap G plans cost more in the short run but provide 100% coverage and some added benefits. If these two are final contenders, deciding will require balancing your insurance protection needs with your checkbook. If you're interested in less popular Medicare Advantage, preferred provider organization called PPO plans, or point of service called POS plans, they're explained in your handbook but usually are more expensive than HMO plans, but less expensive than Medigap plans. Now on to slide 2 to see some examples of plan coverage and costs for HMO and Medigap G. On slide 2, you'll see that our Facebook posting limits our presentation to 5 slides. Therefore, this slide contains a lot of information, so you may want to spend more time reading it. All Medicare A and B enrollees pay $135.50 a month in 2019. Higher income seniors pay more. Part A hospital benefits under Medicare A and B are mostly covered, but physician services benefits are covered up to 80% only. So what's left to pay for is the 20% Medicare doesn't pay for in covered benefits, plus prescription drugs and extras that insurance companies may include to attract buyers. Medicare Advantage or HMO plans, which for our example, pay Part B and network-only benefits using Medicare trust funds. That's why most HMO plans don't charge a premium for Part B. Enrollees already pay $135.50 premium. However, where HMO plans are not cost competitive, premiums are charged. HMO plan added vision, hearing, silver sneakers, some copays, and some premiums for Plan D are paid for by insurance companies who pay for them using large government rebates they are awarded if their bids are competitive and quality is acceptable. Benefits offered vary by county, plan, and insurer. Enrollees are liable for some copays. HMO plans pay for most in-network copays and coinsurance up to an annual out-of-pocket limit of $3,500. The limit is $6,700 in other states across the USA and counties. HMO insurers pay the balance. Alternatively, Medigap plan data, using an example of Sumter County, Florida, requires payment of a $203 a month premium, plus enrollees pay $185 Plan B deductible. Medigap G pays Part A hospital benefits, covers all deductibles and coinsurance benefits, 3 pints of blood, and more hospice and nursing care benefits. Medigap G also pays Plan B Medicare services benefits that cover all of the 20% of coinsurance that Medicare doesn't pay for. Plus it pays for excess provider charges and pays for foreign travel emergencies as shown at the bottom of this slide. Thus, Medigap G basically covers everything Medicare does not 100%. On slide 3, Medigap G plan example costs are $203 a month, plus $185 deductible, or $2,621 a year. We added another $30 a month or $360 a year for prescription drug coverage, resulting in an estimated cost of $29.61 a year, or about $247 a month for A, B, and D, excluding drug copays. Round it to $250 a month or $33,000 a year based on prices in Sumter County, Florida. It's difficult to estimate annual out-of-pocket prescription drug costs between individual plans and those offered by Medicare Advantage plans. In general, there appears to be little difference except for the fact that MA premiums are subsidized by the government. The Medicare Advantage HMO plan enrollees' added premiums and copays are small, as they should be since enrollees already pay the $135.50 a month as mentioned earlier for Medicare's 80% protection. What's speculative is how much of the $3,500 out-of-pocket enrollees will have to pay. The bottom line is that seniors who have just turned age 65 and are generally more healthy and optimistic bet they will not have to pay more than $2,981 a year of the $3,500 out-of-pocket maximum that must be paid by HM enrollees. If they exceed $2,981, this would mean that they are paying more for that year than those in a Medigap G plan. It is this element of risk, the guess or the gamble, that you can say stay under the $2,981, combined with Medicare plan rules that make the decision to choose Medicare Advantage HMOs over Medigap G plans a tough decision. Slide 4 introduces 3 critical pitfalls every HMO plan potential enrollee must consider, and 1 pitfall that could affect Medicare G enrollees. Number 1, after 12 months, an HMO plan enrollee may not qualify for a Medigap plan or may be forced to pay a 100% or higher premium penalty to protect Medigap coverage. HMO plan enrollees can't choose out of network or out of state or out of county and country. Providers or services must pay out-of-pocket costs for excesses. HMO access to highly advanced out-of-network specialty hospitals and services like Mayo clinics are not covered, and out-of-pocket costs for them are extremely high. Similarly, there is a Medigap plan risk. Medigap plan enrollees who drop their coverage and switch to original Medicare without supplemental coverage, or who switch to a Medicare Advantage plan, can't return to Medigap. It is these risks that are crucial for you to consider. Guessing wrong can destroy an otherwise good or well-intentioned but uninformed decision. Unfortunately, once healthcare conditions unexpectedly worsen, or we get caught out of network, or the 12-month time window closes, it may be too late to make changes that are not prohibitively costly. All 4 of these pitfalls should be avoided if possible. The final slide displays an example. We used a Medicare Advantage HMO plan from one county as our example, but there are nearly 4,000 of these plans offered by insurers in all counties across the USA. You must choose from what is available in your county. The Medigap G plan we chose is one of the 2 most expensive Medigap plans, but there are others you may choose from in your comparison. All Medigap plans must offer the same benefits by plan, that is, like type through A, B, C, D, all the way through G, K, and L in all states. But pricing differs by state and by insurance company and can vary within states. You may want to develop a measuring tool for comparing plans you are considering, such as the one on this slide. It may help you get comfortable with making a choice. Most Medigap G enrollees who pay about $250 a month for 100% full coverage of Medicare A, B, and D say they will sleep well knowing they are fully protected. Many, 1/3 so far, have chosen a Medicare Advantage plan, HMO version, and 73% of them have selected an HMO. They pay less and say they're comfortable with the added risk. Learn your Medicare and You handbook and consult your state SHIP counselors and Medicare by phone or online, and use the Medicare Plan Finder. You should assess your current personal health, family history, risks inherent in your activities, and especially the chances of needing expensive services out of network or encountering health problems out of state. Start now, get prepared, and make the best decision for you. We hope this presentation stimulates your personal early diligence as you enter the 2020 enrollment period. Thanks for reaching out to the NRLN website at nrln.org and Facebook at facebook.com/NRLN.1 and Instagram and YouTube. Watch for more soon on why NRLN feels Medicare privatization is failing seniors.